no condition.
The condition is permanent. Oh yeah.
No condition.
The condition is permanent. Oh yeah.
Like we are living my bedroom. It's full of so much surprises. You may be up and feel no one like you. In my bedroom, no one knows tomorrow. Never look down on anyone. Let's be there for one another. Cause today is me, tomorrow might be you. Cause no condition.
The condition is permanent. Oh yeah.
Cause no condition.
The condition is permanent. Oh yeah.
Cause no condition.
The condition is permanent. Oh yeah.
Cause no condition.
The condition is permanent. Oh yeah.
This is Chivang's music.
Laughing at someone's situation, not knowing we are all God's creation. But one thing I want them to know, yeah, no condition is permanent. You never know, if someday you will find yourself in that same situation. In this life, you feel today, tomorrow is the promise. In a twinkle of an eye, your story might change. Get courage. No condition.
The condition is permanent. Oh yeah.
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 Like we are living my bedroom, it's full of so much surprises. You may be up and feel no one like you. In my bedroom, no one knows tomorrow. Never look down on anyone. Let's be there for one another. Cause today is me, tomorrow might be you. Cause no condition.
The condition is permanent. Oh yeah.
Cause no condition.
The condition is permanent. Oh yeah.
Cause no condition.
The condition is permanent. Oh yeah.
Cause no condition.
The condition is permanent. Oh yeah.
This is Chivang's music.
Good evening and welcome to the program where Bodi Talk will come to you from the Society for Radio Democracy 98.1 FM. Well, Bodi Talk, they come to you every Thursday from 5 to 6 o'clock. Inside the program, Well Bodi Talk, we can talk about different sickness within the cause, treatment, signs and symptoms, and self-prevention. And we always get experts then at the studio for can talk about different sickness. And inside this edition of the program, Well Bodi Talk, we will talk to Dr. Abubakar Kanu, specialist pediatrician, University of Salon Teaching Hospital Complex. And today, we will talk about sickle cell disease management in children, pain crisis, infections, and burden on families and health system. That's now a topic of discussion today. And maybe they bring you this edition of the program Well Bodi Talk. Musa Kamalana my name. Remember yourself with the listen. You go and watch me live now on Facebook page. You will able to get chance for take part in the program by way you go text on the number 077-981-981. And later inside the program, you go call and make a contribution and ask questions them about the topic we will discuss today. We are sickle cell in picking them. and we experts for today. Now, Dr. Abubakar Kanu, specialist pediatrician, University of Salon Teaching Hospital Complex. Good evening, Doc, and welcome to the program Well Body Talk.
Thank you very much, sir.
Okay.
It's a pleasure being here.
Thank you very much for come. Remember, say now University of Salon Teaching Hospital Complex, they partner with Radio Democracy for Bring Well Body Talk come to you. And this program, they come to you every Thursday. We say Radio Democracy weekly don't dedicate 1 hour for raise awareness about well body issue. And the University of Salon Teaching Hospital Complex self don't volunteer for the we experts them every now and then for ensure say we can talk about different sick them, raise public awareness. And you were they listen the program already people know the number. We already don't they get calls, then we not open the phone line yet. Because at the start of the program we got a quiz. And the quiz based on what we discussed last week. We don't increase the number of winners then. The last edition them now 2. But now we increase them to 3. Plenty thank you to support from the University of Salon Teaching Hospital Complex and Osfred. We are a friend of this program. We always don't follow this program from Manchester, UK. Instead decide for help for make we raise the number of winners them. So we they ask, what you win, you go get 50,000. All leons or 50 leons to pop for each answer where you give to the quiz them. So by so doing, we go make people pay more attention to the thing them or the discourse. Before we come to we guest for today, inside last week edition of the program Well Body Talk, we been get a topic we similar to what we get today. But we don't have been we guest last week. The name of we guest last week and imposition. What's in the name of we guest last week and imposition. And also waiting we guest been talk about born pamai we rob pam pikin. Waiting have been advice for sake of born pamai or for sake of people where they rob born pamai pam pikin. And self waiting have been the doctor in advice for treats Bobby water if you dey work enable give a pikin Bobby for 6 continuous months because you get for go work. What do they do for make the pikin able they get Bobby water even if you dey in office? This na the first 3 sets. You go answer them. The number na 077 981 981 077 981 981. Now the number where you go call and take part in the program. Remember say each question where you answer you get 50,000 leons to pop. Waiting at the name of we guest last week and in position. Waiting it talk about born pamai on Peking and self if you the work. Waiting it talk about how for treat Bobby water where they left the Peking na us. We get to first caller on the line. You name it, we said the call from Well Body Talk.
Hello.
Yes.
Good afternoon. Good evening. How are you?
Would they do fine?
This is Radio Democracy.
Radio Democracy Well Body Talk.
Yeah. Concerning from Britain.
Okay, consensus.
The first question, the name of the doctor last week.
Okay.
Dr. Meribel,
Yeah, okay.
head of Department of Postgraduate and Training University of Sierra Leone. They are also the Dean of Command Pediatrician Association.
Okay. Yes, we guest last week now Dr. Nelly Bell, and in a been the presidents for pediatricians na salon and also dean of faculty na the pediatrician department na College of Medicine and Allied Health Sciences. You quite correct. Congratulations.
Thank you very much. Thank you.
Okay. After the program, we will send you credit. The program Well Body Talk, they continue, and we continue for pick more calls. Waiting the doctor last week been talk about bon pamai. People really want bon pamai pam pikin. What he been talk about that? And also, if you dey work, you know able then a host for the give pikin bobby always. What he talk about the treatment way for give the bobby the pikin for the bobby rather way the left na host so that it will be safe for the pikin. 077-981-981. Una go answer to them wire and we go move forward. 077-981-981. And we add more to the topic here. We add more to the questions. Waiting have been with topic for last week. Waiting have been with topic for last week. 077-981-981. Now the number for call and make a contribution. We don't get first caller and the first winner. But meanwhile, we go continue for P calls. Say 5:30 on the quiz them. Right after that, we no go able pick calls again on the quiz, but rather on the program today. As I mentioned inside today's edition of the program, we topic for today similar to that of last week. We get for talk about picking them, and we guest for today now Dr. Abubakar Kanu, specialist pediatrician, University of Salone Teaching Hospital Complex. Today we'll talk about sickle cell disease management in children, pain, crisis, infections, and burden on families and health system. I come to you, Dr. Abubakar. Good evening and welcome to the program.
Thank you very much.
Okay. We they talk about sickle cell sick today in picking them, but in a broader term, make we look at the sickle cell sick. Or we talk about sickle cell, what will they talk about?
Thank you very much. So sickle cell disease now, the most common disease really affects the blood amongst Africans. So of course, including the African Americans, where they be pulled from Africa, so go as slaves. So it's the most common. Yeah, and in most common thing where people in Sabibo time, that bone sick. So even we can discuss with comrade in a hospital, say okay, you can get a bone sick, then they easily understand which you need to talk about. But that disease really affects the blood and it's very, very common amongst Africans. That's simply put.
Okay, you say when they say when they talk about sickle cell and Salone, it's about the bone sick. Some
Generally,
people think
so most comrade
yes, the bone, yes.
Mm.
That's the general knowledge, even out there. They call them bone sick. But let me look at, you say something that affects the
blood.
The blood.
Yes.
Is it not got anything to do with the bone?
So it kind of gets something to do with the bone indirectly. The bone line they make the blood. Yeah. And the problem in sickle cell now that so normally just imagine you get a road where you just free traffic they pass. Motor they pass, there is no traffic. So generally that's the best way blood for flow you get.
Okay.
But for whatever reason, there's a traffic. So usually then cell and the way they become sickle, then they block traffic. So things not they go before. And once it builds up, what happens is that blood no they reach outside for reach. So it's like then they carry goods them, goes on side and then traffic don't get stuck. Outside for reach, and not they go there. So their side and the way they get deprived of this breeze where they blow so, now it can cause the pain. And most of the time now along the side and there, they bone them, now they side and there. Although it can occur that part of the body, the belly, the sickle cell patient and they can describe and to you, so they can get belly out, if not the belly, now the blood not go better. But most of the time about the bone them, especially the bone the way they make blood, now they the problem can then. And so now the most common way that the way they can present, now that make once we say bone sick, and that's they get able to understand which way they talk about.
What are the causes of sickle cell?
Good question. Because one myth the way some man can get say, okay, sickle cell go transfer like if I didn't hear the person like how somebody get cold. That's not true. So to a large extent, most of the time you need for get parents them we get what we call the gene. So in the way they pass on, we go make you feel like how you did, so you tall, you short, in the way parent and go pass you. So along that in the way they pass you mantle, then can get if they're safe, then you don't get a mistake. Some the parents then they can get the sick, some actually they show any sick. But you get one pan the thing they way abnormal. So if you get them from both parents, then the picking they get them. You understand? So generally, to a large extent, 99.9% of the time, either both parents actually they suffer from sickle cell, or they carry the what we call the abnormal gene. Both of them get them and then pass them to the pikin. Even if they don't get the sickness physically, they look okay. They can carry the gene and pass them on to the pikin.
So, is it possible that both parents get sickle cell, then one pikin not get?
Yes. Say your question again.
Is it possible both parents get sickle cell, or one of the parents then get sickle cell, then one pikin not get?
So, let me try and explain it. So now, two scenarios you explain. So I had to stop. So if na SS, both parents get SS. Then if you watch the way they inherit them, it means the only two way they get for donate na S. Because generally when you do the thing, somebody is suffer from sickle cell na SS na get. Okay? So that means the only two way get for pass on to him begin na the S. So if you be say the other partner back get sickle cell, they suffer from an SS, and then so it likely say almost all of them picking them go get. But if the one actually they suffer from sickle cell na SS, then the other one he not get. Probably in a carrier get AS. You get saying they say you go born half of the picking them. So, but for this they call for every pregnancy. So the mistake where some people can make saying that the total picking them. Anything we get belay get chance you go born 50% chance you go born sickle cell picking, 50% chance this you go born picking in a career. Where it means say that what the career or somebody then can say trait. It means say he not the suffer from the sick. But if you meet up another partner we get that same thing they get energy for born picking. So it's a bit I hope it clear for we listeners them. If both parents are SS, then the only few they get for pass na that one day. If both na AS, they get tendency.
What are the AS and the SS?
So na abbreviations the way they make for let people then get and clear. So the A na one way normal. So that means if somebody gets normal one from him mama, gets normal one from him papa, it means in a AA or two normal. You understand? Even a S, it means say you get the sickle cell gene we then transfer to them. So if all two it take from the mama na S, it take from the papa na S, it means say in a SS. And the only time we go show the sick, na we na it go show say na we na SS. And the we go normal, now we in a AA, that means you receive normal A, remember na normal from the mama, A normal from the papa. Or if you receive from one parent, you receive A, the other and you receive S. Essentially, they no go show the signs. They one and I hope that's clear now.
Yes, so today we look at the one in picking them, but normally we look at it generally. First of all, if they talk about the causes, then when they come to picking the immune side and some of the treatment and how they notice signs and symptoms, is there any risk factor for sickle cell? Because most times people they perceive say that people are dry and they get sickle cell. One person they get
So generally, so it's not because the person dry make it get sickle cell. Yeah. But rather, sickle cell, they make the picking and they get poor growth. They know they grow well. You understand? And that's why they are slim. So it's not like because you dry, now make you get sickle cell. Rather than because the person gets sickle cell,
You go dry.
make the person get poor weight gain, especially where the one the weight and sickle cell not properly controlled. You get so we'll get discuss later down the line what you're waiting for they do for them. The one that we be say they know they take with the medicine they them for take, they know they eat well and all this. Then tend for they get the chronic form and they are usually quite slim and all.
Okay. Continue for stay with me inside the program. Quick one. We still get 100 leons for grab for we listeners them as to the quiz. So to the guest them who been get or the topic who been get last week. I'll ask what's have been the topic who we get last week, and one they don't answer the doctor in name and the imposition. But again, would what's in the doctor who been get last week? Talk about Bon Pamai. We were born from my Pampikin. What he say about that, and also, and he talk about the issue of breastfeeding for give Bobito Pikin. But if you and mama we the work enable give the Pikin Bobby for 6 months, what in advice in terms of for take care of the Bobby? The program will body talk. We get 9 more minutes. The money still there. We want to make people and win them because we know one return that money day again. 077 981 981 077 981 981. Call and win that money day. As I mentioned, say we don't get the support so that we able for let the money out to the people because us Fred, a fervent listener of this program from Manchester, don't decide for support we and also we get support from the University of Salon Teaching Hospital Complex. So we could add the number of winners them. The program will body talk they continue 77981 you can call we now this line 077981 or you can still call on WhatsApp because the number still himself there on WhatsApp or you call we direct call. We guest for today na Dr. Abubakar Kanu, specialist pediatrician, University of Salon Teaching Hospital Complex. We topic for today na sickle cell disease management in children, pain, crisis, infections, and burden on families and health system. Now we can look at the topic proper, rounding up on the myth them around sickle cell. There is this saying that if somebody you get sickle cell, you reach certain age, if the sickle cell not kill you, that mean you go die not from the sickle cell again. Is that true?
It's definitely a myth, yeah, because I mean for quite a long time, people they get sickle cell not be they get the right management. Yeah, they don't be they get the right management. So I mean as then they reach then 16, 17, 18 years, they can usually die from complications of sickle cell. And even beyond that period, if you also the sickle cell not gets control, they could also die from sickle cell complication. Yeah, so not because they don't cross the age means they don't go die from sickle cell complications. If poorly managed, they can die from it too.
But there is any age limit that this sickle cell will stop and bug you?
So, not really. So that's something you need for manage for a lifetime. So you need constant follow-up. We'll get for discuss some of the things that they need for do medications, with them for take, and then so you need constant follow-up. It's not like you go out to live the sickle cell. The problem there in your genetic makeup, and that's how the person come at the world, and it just get to be managed.
Okay. The program now well body talking the country from the Society for Radio Democracy 98.1 FM. We topic today now sickle cell in picking them. When we look at sickle cell in picking them, we say nothing we get to do with the bone. Picking in the bone are very, very young.
Yeah.
At which age picking they get sickle cell?
So generally, first of all, the getting part of them is right from conception. You get? So because at that point you they receive supply from your parents. So when then two then they fused together, they don't make you. So right at that point you don't already get the what we forget sickle cell. So once the picking comes out, at what point did it begin manifest? Yeah, typically around 6 months. So the explanation for that is that the one way we all get the obedience of belly we call fetal hemoglobin. Because the problem, remember, na the blood. And this thing also way outside the problem with sickle cell, na the thing why they blow so this breeze why they blow so the way they pull this breeze for me also spread that all across the body. They call it hemoglobin. Now they the problem there. You understand, eh? So but the one way we get to the all inside our belly, they call it fetal hemoglobin. They get one good quality because we all hold inside the belly we are tenants. The mama na in the blow for we. We not the blow for we serve inside the belly. So once we receive, we need something where they make sure say it keep the oxygen very well. So that we go get a lot of oxygen because now give them the give. So that fetal hemoglobin get a quality there. For able to make sure say the breeze we catch them, they hold them for a very long time and then they go and spread them. So in a day, but we all take by 6 months, it begin the left way. Which is the left now, the one we get for they would stay we all and die with that type day. And that type day now in gets which we call so that hemoglobin they get cable them where they make out with. So it's like you get like how we get this mic now this studio. You get like 4 cable we come together and make them. The one who side the problem they pass sickle cell now the one where you they get where you don't cross 6 months. And once you begin make that one day, now that's the one for sickle cell they appear. That one way we all born with, we not get them. You know the sickle, the one we get problem by sickle cell, and not deep on that one day. Okay. So you know they manifest. So once that one they were born with done they lost, the new one where we they make, we get for day with we till we die. Now it gets the one way sickle cell get problem with. So that's why at 6 months I say they manifest. But when you they get them, it's right from the time we all the one way get them they born. Once they conceive them, they don't get them, and they manifest at 6 months.
At 6 months, it manifests. How the mama go know or the parents go know say this picking get sickle cell? So quick one, we get a call. We still get questions.
Okay, let's
on the
somebody
floor,
with this
and
morning
we
quickly.
still continue. We get 3 more minutes for no close that. The name who said the call from Bodi Talk.
I call from Allentown.
From Allentown, Marama, we get 3 questions for grab. 1, waiting the doctor talk about born pamai pam picking, and 2, waiting advice if you dey give picking Bobby, then you dey work. How you dey take care of that Bobby? How you dey keep the Bobby? And waiting have been the topic for last week. Who's why you want to answer?
The one I want to answer the one where the doctor says for 18 months from 0 to 6 months, waiting best for them. I know how to answer.
Okay.
Because for say a woman born a young chicken, if I make sure say again I only breastfeeding that breastfeeding only from 0 to 6 months. And the first body water where the colostrum, that water they then you say the first maternity chicken ever get. They make the chicken go strong and very chicken when they give body from 0 to 6 months, they get plenty. Really above at all. Because the body now water. So people like to say the chicken need water. At that age, the chicken don't need water because the body already gets water where they keep the chicken going. And it will make sure it give that chicken enough body where don't give the first side of the body, you empty now, they go to the other breast and give the chicken enough so that the chicken will for keep their food. And that will be the way it will make sure
now if you now working, if you now mama way the work, you know able then host for give picking 6 months because office then at 3 months they give. How you able to keep the Bobby? How you able to give Bobby to that picking even when you in our office? What did the doctor say about that?
Sometimes if the mama they work early morning, we don't give the chicken enough Bobby. Sometimes and they depend container outside that Bobby and keep them like normal temperature. We like because the way they left the chicken so we don't let her give the chicken that Bobby. They say the mama they come. They express the baby because now the doctor will say one side they overtake constantly like they give other Bobby than the chicken. But in we own case we express them like clean container and put a normal temperature. Whenever the chicken need the Bobby, the first way they take care of that chicken is give that chicken that Bobby. Because that Bobby no more, we forget chicken from 0 to 6 months.
Congratulations, you don't win the 50 million. So what you say my name again?
Mariam from Arlington.
Okay, Mariam Allentown. Okay, thank you very much. You don't win brand name and exactly what in the woman been talk about her for keep the Bobby water in that. Thank you.
Okay.
Okay. Ah, okay. Yes. You never who said the call from. Hello.
Yeah, hello, good evening.
Good evening.
Yeah, I
Yes.
name David Sivali. I dey call from Grafton.
David Silvali from Grafton. Yes.
Yeah, I the one for answer. Yeah, the topic for last week.
Which one? Yes. What's in the
Yeah.
topic?
Yeah, meet in Newborn Care and Pediatric Association in Sierra Leone at its upcoming conference.
Okay. Yes. Congratulations. You self don't win that. I think when I wait last minute. So what's he saying at the name again?
David.
David Sivali.
David Silvali.
Yeah, yeah, David Sivali. David Sivali.
Okay, from Grafton, right?
Yes, sir. Yes, sir.
Okay, so after the program, they send the credits. Congratulations, David.
Okay, sir. Thank you very much.
Okay. Okay, the program now will body talk. I think the couple who we get they don't answer the questions then. Plenty thank you to you a call and answer. I mean 5:30 for don't close, but exactly 5:28, 5:30 we'll get two callers. Then we all win straight off. The program now will body talk. We come to you from the Society for Radio Democracy 98.1 FM. Just listen to today Yun again attentively. We go draw. We'll get quiz on today program next week. Who say you they win couple again. 7798191. Now the number. We'll go open the phone line later. Who say you go call and ask anything about sickle cell as we get Dr. Abubakar Kanu, specialist pediatrician from the University of Salon Teaching Hospital Complex. May they bring you this edition of the program, Musa Kamana Minim. So, I mean, they ask you that you say 6 months, yes, you go begin manifest. What are the signs and symptoms for letting you know, say this speaking, you get sickle cell?
Okay, good question. So, the signs and symptoms will make the Kumbra suspect. So, number one, especially when they're less than 1 year, some even less than 2 years, if they begin to get what we call hand and foot swelling. So you could just see the hand and the foot then they swell. Yeah, so then in one sign, what's going on here? Picking where be say it complain in bone them, especially where they get older. Begin to complain in bone them. Also they complain in bone then sit in the arts. Also they complain in bone then sit in the arts. Another one we go know that speaking in eye them, all 10 in the yellow. And one big one will be say they get repeated blood transfusion. So they count and get blood after some 10 they count and buy and get blood, you say back and get blood. So repeatedly it is suspect. But the best way now that's just make let the pikin know what you call in genotype. Do the pikin blood tests, and then you know whether AA, that means he receive both normal genes there from his parents them. A from the when a normal one from one parent, A from a normal parent. You do the other one, if the AS, you know, so it's in a, even an SS, you know, say, okay, this may picking get sickle cell. Then you go know it's not the best way for prevent. But those are ways, and of course, if a family gets sickle cell, more so the reason for you you check you picking them. But now some of the way they are and they can suspect sickle cell from picking them.
Okay, so because maybe they will say, oh, there are other sickness we get the same signs and symptoms. It's about differentiating these two. That these signs we don't explain. So as I say, and probably cannot go no say, I not go conclude say na ABCD. What are the first step we for do if you see them signs here?
So generally we can say go to hospital. And then, so the earlier the better. Go to hospital and then, like I said, we send you for HB electrophoresis. We know the tests for know which in your status. So whether you know AA, you know AS, or you know SS. So if the earlier you report and we pick them up, the earlier we start the treatment, the better the outcome. We get people that we get sickle cell, we don't live many years. You understand? So the earlier the better. So that's the recommendation.
The program, Well Body Talk, they continue to come to you from the Society for Radio Democracy 98.1 FM. And we look at the sickle cell. We don't talk about the origin and how picking they get them when they begin manifest and how they notice them. How do they manage sickle cell in picking?
Okay, so that's that in a broad one.
Okay.
So we got different wisdom. So you get the 10 way be say, and now they get crisis. You get the 10 way, you get crisis. Now two different things then.
Okay. Let's talk about the non-crisis stage.
So the 10 way, you know, get crisis. We get what to call supplements. They already give them. See the way they help them. So one are folic acid, where they will take every single day of their life. So if you ever live 40, 60 years in this world, ideally for like take folic acid every single day for the next how many years. So folic acid, so we get now the Zincovit syrup, we can give them. And then we can also give them vitamin C. Yeah, we can also give them. So when they less 3 years, we can use Penvic. When they go above 3 years, we can recommend let them get vaccine. Yeah, and then we get a medicine we call hydroxyurea. Fantastic medication where it don't change the management of sickle cell patients. And so then anyway, sickle cell patients 16, 17, 18 years, they don't die, it's gone. Now they live longer, especially if we know early and start them by age 9 months going forward. Oh, they get fantastic outcome. So and then so that one in the baseline. So that's where they know they get crisis. And so they manage them. And then they take also malaria prevention, fancy that. But they give them every Sunday, so they call on Sunday to Sunday for let it come and get and clear. So we can a clinic, we say you don't give picking Sunday to Sunday. You say, yes, again last Sunday.
So when I go inform the parent and say the picking get sickle cell.
Oh yes, therefore no. Yeah, I mean it's part of the management for letting take the thing seriously, they will take the medicine because they need for aware. So once we suspect, we get the discussion with you, with the suspect, we send you for do the test, the result come, we discuss with you waiting a sickle cell as I do so at the radio station, which you need for do for you picking, and waiting we expect. You understand? So waiting at the benefits of you sticking to the treatment. So therefore be aware.
Comrade need for worry at all if them diagnose say the picking get sickle cell?
Well, of course there is some worry there. We go come in because the thing gets emotional burden. It gets some financial implications we involve if the beginner gets sickle cell as compared to we get sickle cell, the money we go spend because you get can they go to an hospital. Those are some of the things you get for. Either if you get motorcar, you get fuel, you get can they go, you go sit, you wait stay, doctor see you. You ever can get medications. Remember, most of the medications not daily, so there's cost implication. You get some picking where they go suffer something in a school. So companies they can generally worry. You understand? Hotel and say the picking get sickle cell, but of course with their laden fears by way to do what we call counseling one-on-one. Get 10, 15, sometimes depending on the discussion, 30 minutes. And calm them down. They ask me question like how you did so now. Okay, so maybe can go get this, they will go transfer this, and we are lay them fears. But generally there is some worry. But by the time we don't get discussion with them on the outcome, if they do it in they for do at an early stage.
We still look at the non-crisis stage.
Yeah.
And we come to the crisis stage.
Yeah.
But generally, if picking diagnosed of cancer, that get any potential for
you mean sickle cell?
Yes, I beg your pardon. Sickle cell. If we can get sickle cell, is there any possibility that if this picking get potential, whether for engaging sports, engaging activities, or it gets any impact on in activities, whether academia or social?
So, generally, if well controlled, especially in academia, they will excel. Then they go to normal school and all. You understand? Also, the problem they like I say, if you not manage the sickle cell well, Because like I remember I say where the traffic block, where the sickle cell and the traffic not the flow. And if a block, goods will not be delivered. Like when the oxygen we me the blow. So if you go all over the body, that make where you see left for blow, you don't die. Because that breeze the they go. So once dancing and they block, they know they receive what they call if you're corner the brain gradually they begin to get like somebody gets stroke, but not to like how a big now all side on die. It's not small one. They get small stroke. And as they get and gradually that's why it affects in brain, in mental thinking, and it begin dropping at school. So if well controlled, they get a problem in there. If you're not well controlled, they get gradually in thinking they begin decline at school and they begin affect in performance. In terms of exercise, we can advise them let avoid too much rigorous exercise. Because one of the things where they trigger the crisis, now they either like where you don't play ball pass mark, you don't sweat, you lost water, or they fight for breeze, to get beaucoup breeze. They trigger in attack. They can play there normal, play there like how picking and they do, but too much active one where you need for sweat pass mark, you get like their 90-minute football business. It's a bit challenging for them because they could have crisis shortly after that.
What are this management apart from the treatment that we mentioned? Any management there?
So you mean where they not get crisis yet?
Where they not get crisis yet? Would they come to the crisis? Where they not get crisis?
So
what are the management?
So where they not get crisis yet? One of the things that we now the new thing that we did now that what we call gene editing. Remember the problem I say now from the mantle where you parents then give that is the problem there. So which man and don't find out ways the way be say it can able for edit them the gene. It edit them from that SS, it edit them to AA. You understand? But it cost money, reach salon yet. The other one, then even in the which man country side, it cost over $2 million. So not they all even able to get access to the other one I used to call bone marrow transplant. Remember, in the initial start of the program, I say the bone marrow, then they make blood. Now the part side is they come. So if they change them, give them one way be saying they're able to make normal blood, in another way for treat them. You understand? So if they don't get any crisis, so either they follow up in a clinic, then folic acid, zincovit, vitamin C, then Sunday to Sunday, the hydroxyurea. The one we get chance, they can do the bone marrow transplant or they do that gene editing. So those are some of the things that we can do for them.
The program now, Bodi Talk, will come to you from the Society for Radio Democracy 98.1 FM. We get Dr. Abubakar Kano, specialist pediatrician, University of Salon Teaching Hospital Complex. Today we look at sickle cell disease management in picking them, pain, crisis, infections, and burden on families and health. We don't look at the crisis stage of the sickle cell. We don't talk about the non-crisis stage. We'll talk about crisis stage. What thing will they talk about?
Okay, so at that point, the most common one where Kumbrad and Sabi, now the one where they affect the bone them. You understand? Like I say now, because the traffic block, blood not go before. And once blood not go before, that side pain they set in. So if now the bone them, when are the most common sites, and they begin cry, bone pain. And the mistake we must come back into, they begin they form pain. No underrated the pain where you pick you don't confirm in a sickle cell. They say this is a form pain. It can also occur at the belly. So just the bone then. The belly self can't. It can also occur at the chest. In fact, the one way they occur at the chest. Now one of the most dangerous one them. It kill quick. In fact, the big people and stuff, we don't die from sickle cell. Now from the way they affect the chest. That's that pain where they affect the chest. If you not control the sickle cell, you begin to get the pain at the chest and neglect them, it's a problem. So the one for and of course, they can also occur at the brain, and that can lead to stroke. Yeah, so that one is the most common crisis. But you get other form them.
Okay.
You get the one where you make the blood drop. You get the one where they make one thing where they are it is at the belly, the left side of the belly for the one where at the radio, then they listen. The one where at the TV might see where the point. But the left side of the belly, it did it now like a military barracks. Usai Sojamane and they train them in sickle cell patients them. The same thing with the happen with the belly, the bone them. That side the blood they not they reach there. So intermittently blood they cut off. Anytime we blood cut off, some side way they die panam. Anytime we cut off is like the military barracks they burn. Side they burn panam. It burn. So now small parts by the building all left. It left they make it all side on burn. Yeah, if that one day happen, I think make them get sick. What times can they reverse they take place? The thing there, it they swell, it big. It make blood not able for come out inside again. It continue for big. It can't say the bottom belly all it big. And if that happen, it make like it get a thing called shock. Blood not the flow God aside. It's like all the blood can't get on one side. You understand? And now one day again a big problem. If that happens to them, in fact, that is an emergency. But usually in a health care professionals able to identify this one. Most of the one that we come right and able to identify another one way they affect the bone. You get the other ones where they make the blood they reduce. You get the where the blood can just go get another military barracks there and not the come out. And that's a disaster. Yeah.
So what think can lead to the crisis stage? Make you reach from the crisis stage, from non-crisis to crisis?
So from non-crisis to crisis, good one. So like we insist in the council, where the extremes of the temperatures. So now where the place warm, if the place is extremely hot, no problem. So the heat of itself, they trigger the crisis. The heat of itself, they make the beginning lost heat. They lost water, and they cause crisis. So for whatever reason, you make the beginning lost water. So now we tell and let them drink plenty. So either if you not drink plenty, or if lost some, maybe a rumbele, a vomit, a lost plenty water, then they trigger. We insist in the council where the place cold, and then we tell them let them get them gassy there and all. We place cold per smack, it trigger the crisis. If they get any infection, any sickle cell patients will get fever. It's an emergency. Any paper doctor them. I take advice, I go buy Panadol, and I go to advice in a pharmacy, and then they prepare doctor sickle cell patient. Then get fever, it's an emergency. Take them, go to hospital one time. So now then are some of the common things we can trigger them. And of course, vigorous exercise, as I've mentioned.
Okay. 77981 are the number where you go call and make a contribution inside the program Well Body Talk. Today we'll talk about sickle cell disease management in children, pain crisis, infections, and burden on families and health system. 077-981-981. Call and ask anything or raise any concern. We get the expert at the studio in Dr. Abubakar Kanu, in a specialist pediatrician, University of Salon Teaching Hospital Complex. May they bring you this edition of the program Well Body Talk. Musa Kamara na minim 77981 Now the number we go call and make a contribution inside the program Well Body Talk. And Doc, we don't look at the sickle cell management in picking them. We don't look at the crisis stage and non-crisis stage. We get a caller on the line. We pick this call, and your name who said the call from Well Body Talk. Hello, your name who said the call from. Hello? Hello? 77981 call and make a contribution inside the program. The program now Well Body Talk. We come to you from the Society for Radio Democracy 98.1 FM. 77981 We'll get a caller on the line. You name where the call from. Okay, 77981 call and make a contribution inside the program Well Body Talk. What in a look at the infections aspects of sickle cell? What do you mean by the infection aspect of we'll pick this call quick and come back to the studio.
Okay.
The name I will say the call from Well Body Talk.
Williams, how are you?
How they do?
So, very blessed thank to the doctor about management.
Okay.
I'm also clear about those we can say we can get sickle cell. Sometimes the advisor will be then to indicate when antibiotic, I don't know how far that is correct. Please, number one. Secondly, about the age. You know, there's things that when people don't get food and then you're 21 after that age now, you don't survive. But before that age, the tendency to be able to attend time. How far of it also. Thank you very much.
Let's talk about the age where we don't answer earlier that when you're 21 years, you know, die. There's a myth that you know go die again from sickle cell, and he also ask about you get the first one right. So you go to take them down. So we go answer more because before they are called, they will be to talk about the infections and the burden whether they get on family and the health system.
Yeah, so I will start for talk about the infection part. What I tell you about that military barracks, where they at the left side of Ubele. So if that one day eventually they get blood, that military barracks they get work now for what we call encapsulated organisms. Them organisms they will get capsule where they wear coat, where they can attack you. Now assassins them. The one that they very dangerous. So normally if sickle cell they knock out that barracks, they will produce them so German in there. And once then they happen, the problem they can inside. So now then they get them bad infection they can kill them. So then okay.
Yes, we got the caller on the line. You never was had a call from.
Yeah, I mean, I was trying to call from Manchester. Musa, thank you very much.
Osfred, thank you very much. Irregular guest at the program from Manchester, and thanks for the support.
Yeah, thank you very much from me. And thanks to Mr. Kanu. Kanu is a very clever man. I love the way they explain. I especially that area where they explain about the oxygen and the movement. But he's very clever, man. I like his teaching. Yeah. But the area I just want to add for, I know say like the oxygen, of course, it helps for leg to release the energy. Just like that gunpowder with the inside bullet, where it make the bullet move. Now in that oxygen. When you eat, that chop would be by yourself, for let you move, come back for respond, and that oxygen they would move. So if the cell is sickle, round, it will obviously cause problems. Just one thing, I'm not saying that they do break now, because right now, what they do, my revolutionized technology that they use now, instead of just for treatment and diagnose, now then they try for go in terms of management and cure them, which is very good. I hope you don't explain about that CRISP, one of that technology for apply some foreign cells and try to approve some other cells them with the can of the gene, and then get some they even yourself then get they call it lentiviral, where they help for let they approve the cells and back so let them produce other cells in the body, which is quite good. The only thing now I would just want to see how much they don't know see them technology out there, bone marrow and stuff. And how much the ministry of itself they know. See that technology are then do, but how we go able to try bring them here? How much it will cost to it? Or what we will train? How we will do this? Is there anything like that in place? Or now they know what the doctors they know because of their knowledge, the government not know. Because if the government they know, if even steps they're not able to do it now, there might be a way. Just like our Wakabot, they say that money where they will use for go build that party office. Let them go take and put them, but let's see the day. I don't think I'd ask someone if anything in place will then get for let them go present to the ministry. Say these are things we might look at in case of one for improve the health system. Thank you very much, Mr. Kanu, and thank you all for watching. God bless you all. Yeah?
Thank you very much, Osfred from Manchester. Always a fervent listeners to Radio Democracy, and one of the people we don't support Radio Democracy for CC. We add upon the prize them we give to listeners of this program. We call and answer questions. The moody ask with regards well-bodied the program. Plenty thank you, Osfred. Always they join this program from the UK. You get quite a lot of concerns then for answer. Look at the infection. Quick one they answer. Then when we don't come inside, then we round up the program. We don't get better time again.
Okay. So quick one, like I said, the infection usually what you make a bad now that the one and then the blood then they multiply them born and then they spread all over the body. That's why it's very bad. So all the infection in the way to call them encapsulated organism, where they were cooked, where they can attack you. Once sickle cell, they're not able to clear them well. So they can get infection at the brain, they can spread going at the lungs, and it's important, once it go at the blood, it is spread all over, all parts of the body. And so that make one sickle cell patient get fever. No pepper doctor. Because at that point, also it starts, not today the level. It they work at the blood, go any part in the body. If you go to the brain, it cause brain infection. You go to the chest infection. You go to wet the parts, it cause wet infection. You can go to the bone, it cause bone infection. Different parts in the body. So that's it about infection. I think somebody asked about Penvic. I think I mentioned them.
Yes, Penvic and the issue of 21 years of age.
Yeah, I think 21 years I'll be addressing. But if you manage them well, they could live many, many years 40, 50, 60, 70, 80, as the case might be.
So, amen.
If the person get money for do this gene therapy and bone transplant, yes, that is a curative part of them. But aside from that, they with the manager, right throughout. Now manage with the manager.
Okay.
And then, so this PNVK part, like the best management, now we they get until they reach 5 years. So by less 3 years, well, I know I'm making call dose them, but when they give them half tablet, 125, then they take them, and then within the less 5, between 3 and 5, we they give them 250. Above 5, we need to give them vaccine. You know, the PNVK, not they work better. So then, seeing the way they affect, so typhoid, one of the way they come, where they wear coat for can affect, so they give them typhoid vaccine. The other one, they part of the under 5 vaccine them, then they get them free health. But typhoid is not the under free health. We get the other meningococcal is not the under free health. So usually I don't treat them, the pneumococcal is the under 5. But the typhoid and the meningococcal, they're not the under 5 vaccine them. So they usually need for get them outside of the free health. And then as for foods them, so generally we can advise them for let them avoid for take extra iron. So food they way rich in we get pasmac iron, we they tell let them know it's them boku. Or they not for even take extra iron. So then blood tablets them we get iron. Then for avoid them. Now if you watch them see up them, they all call as zinco vit. You not get iron. They all get iron as zinco fa. No, they for avoid them. Yeah. I know say time done the best way.
Yes, of course.
Let they wrap up. And then as for Ministry of Health, generally most of the area are doctors them and they are quite aware of the challenge. But me as a practitioner, realistically, we kind of there a bit far off. If you watch how they go, I know the series in the next 1 year for solve them. It might take some time, but we are getting there because we don't begin to get then cancer units, then blah blah blah. The way they approach then cancer thing in there, that's some of the thing them we get for the bone marrow transplant and all. It get for day in place. The thing we get for each day. We don't even get somebody we don't go study how to do then transplant then there. So let's start from there. But ministry is fully aware, but I think we get a lot of challenges for now. Where we not go reach and it's at the point where they was let's be managing them with but of course it would be welcoming if we get somebody will go support this discussion and start them. I mean I seen them bring and come up. Who knows, maybe we'll get some good will partners that will go and can start them and it will be welcome.
Plenty thank you for joining me Saturday edition of the program Bodi Talk.
Yeah.
In name now Dr. Abubakar Kanu, in a specialist pediatrician, University of Salon Teaching Hospital Complex. Inside the program Bodi Talk, we talk about sickle cell disease management in picking them, pain crisis, infections, and burden on health and on the family. And plenty thank you for joining me Saturday edition of the program Bodi Talk.
You're welcome.
And plenty thank you to Uda call and contributes. Plenty thank you to all the winners. Then congratulations. Right after this program, una dey receive una credit them. Una continue for listening to Radio Democracy, and you self with out there want for support this program for raise more awareness about well body. We can support Radio Democracy. Don't provide the airtime. Don't provide the staffs for conduct the program. University of Salon Teaching Hospital Complex. They provide the experts them, and also they support we with winners them for small money for give winners them. So if you self will listen, you get for support, we go welcome them because we go add more people we get for the win. We go raise more awareness and draw more people to the program Well Body Talk. Plenty thank you to me producer Karifa to content. And plenty thank you to Mary Kamara Bangura. We make una see you live na Facebook page. In case you miss part of the program or the whole program, you can go on our Facebook page and follow. And also plenty thank you to Madi Cry for in technical support. Musa Kamara, I may bring you this edition of the program. They say bye bye.
The condition is permanent. Yeah.